Question 1. A client with septic shock is receiving IV fluids and norepinephrine. The nurse notes map of 58 millimeters of mercury. Urine output 10 milliliters per HR and crackles in both lungs. The provider orders an additional 1L fluid bolus. What is the first action the nurse should take? A. Administer the full 1L fluid bolus immediately. B. Titrate norepinephrine to maintain MAP greater than or equal to 65 millimeters of mercury. C. Notify the provider before giving fluids. D. Place the client on high-flow oxygen. Answer B. Titrate norepinephrine to maintain MAP greater than or equal to 65 millimeters of mercury. Rationale. Maintaining perfusion takes priority over fluid administration due to signs of fluid overload. After stabilizing MAP, fluids can be cautiously given. Oxygen supports hypoxemia but does not resolve hypotension. Question 2. A client post-thyroidectomy develops stridor, hoarseness, and neck swelling. After calling the rapid response team, which action should the nurse perform immediately? A. Elevate the head of the bed 30 degrees. B. Administer IV corticosteroids. C. Prepare for emergency tracheostomy or intubation. D. Apply ice to the neck. Answer C. Prepare for emergency tracheostomy or intubation. Rationale. Airway compromise is life-threatening. Supportive measures help, but securing the airway takes precedence. Corticosteroids may help swelling but act too slowly. Ice does not prevent obstruction. Question 3. A client with diabetic ketoacidosis receives IV insulin. Potassium is 3.0 milliequivalent per L. Blood glucose drops from 420 milligrams per deciliter to 250 milligrams per deciliter over 1 hour. What is the nurse's first priority? A. Continue insulin at current rate. B. Administer IV potassium before continuing insulin. C. Notify the provider about glucose reduction. D. Hold insulin and monitor. Answer B. Administer IV potassium before continuing insulin. Rationale. Insulin drives potassium into cells, worsening hypokalemia and risking fatal arrhythmias. Glucose is dropping appropriately, but hypokalemia is life-threatening. Question 4. A nurse is assigned 4 clients. Which one should the nurse assess first? 1. Post-MI with chest discomfort 3 out of 10. 2. New onset stroke symptoms. 3. Post-op day 1 client with stable vitals. 4. Client with hypertension reporting headache. A. Post-MI client. B. Stroke client. C. Post-op client. D. Hypertension client. Answer B. Stroke client. Rationale. Acute stroke requires time-sensitive intervention, TPA window. Chest discomfort is mild. Post-op and hypertension clients are stable. Prioritization is based on risk of irreversible damage or death. Question 5. A client with a tracheostomy develops oxygen saturation 78%, gurgling sounds, and accessory muscle use. After suctioning restores some airflow, the client becomes lethargic. What is the next action? A. Reassess oxygen saturation. B. Call rapid response team immediately. C. Increase suction frequency. D. Place client in high Fowler's position. Answer B. Call rapid response team immediately. Rationale. Lethargy indicates possible airway compromise or hypoxemia. Immediate escalation is necessary. Reassessing alone is insufficient. Suctioning again may help, but is not priority if deterioration occurs. Question 6. A client post-abdominal surgery has sudden hypotension, BP 78/50, tachycardia, heart rate 130, and abdominal distension. The nurse starts IV fluids and calls the provider. While awaiting response, the client develops confusion and cool extremities. What is the priority next step? A. Administer prescribed analgesics. B. Prepare for possible surgical intervention. C. Elevate legs to increase blood pressure. D. Continue monitoring vitals. Answer B. Prepare for possible surgical intervention. Rationale: signs indicate internal hemorrhage and shock. Immediate definitive treatment surgery is required. Analgesics, positioning, or monitoring alone will not address life-threatening bleeding. Question 7. A client with atrial fibrillation on heparin reports black stools. Platelet count is 95,000 per cubic millimeter. Hemoglobin 7.5 g per deciliter. What should the nurse do first? A. Continue heparin and monitor. B. Hold heparin and notify provider immediately. C. Administer oral iron supplement. D. Encourage fluids. Answer B. Hold heparin and notify provider immediately. Rationale: gastrointestinal bleeding is life-threatening. Heparin should be stopped immediately. Iron or fluids do not treat active bleeding. Question 8. A nurse is caring for a client receiving TPN. The client becomes weak, tremulous, and diaphoretic after TPN bag runs out. Which intervention is prioritized? A. Check blood glucose. B. Hang 10% dextrose in water immediately. C. Notify provider. D. Increase TPN rate once bag replaced. Answer B. Hang 10% dextrose in water immediately. Rationale: sudden TPN discontinuation can cause severe hypoglycemia. Immediate glucose replacement prevents life-threatening complications. Glucose check is important but should not delay intervention. Question 9. A client with Guillain-Barré syndrome reports increasing shortness of breath and inability to cough. Respiratory rate is 30 per minute. SpO2 88% on room air. What is the first priority action? A. Encourage coughing and deep breathing. B. Prepare for intubation and mechanical ventilation. C. Administer oxygen via nasal cannula. D. Reassess in 15 minutes. Answer B. Prepare for intubation and mechanical ventilation. Rationale: inability to clear secretions and hypoxemia indicates impending respiratory failure. Oxygen and coughing are supportive but insufficient. Delaying intubation risks respiratory arrest. Question 10. A nurse is caring for a client with advanced cancer who refuses pain medication, stating, "I don't want to be addicted." The client's pain score is 9 out of 10. Which action is most appropriate? A. Respect the client's decision and do not administer analgesics. B. Educate the client about safe opioid use and benefits for quality of life. C. Document refusal and inform family to persuade client. D. Administer a lower than prescribed dose to avoid addiction. Answer B. Educate the client about safe opioid use and benefits for quality of life. Rationale: patient autonomy and informed decision-making are critical. Education addresses misconceptions about addiction and allows the client to make an informed choice. Underdosing or ignoring needs is unsafe. Question 11. A client with severe heart failure is on IV furosemide. The nurse notes O2 saturation 88%, crackles in both lungs, and weight gain of 3 pounds in 24 hours. The provider orders another dose of furosemide. What should the nurse do first? A. Administer the furosemide immediately. B. Assess blood pressure and electrolytes before giving the dose. C. Call the provider to clarify the order. D. Place the client in high Fowler's position and monitor. Answer B. Assess blood pressure and electrolytes before giving the dose. Rationale: the client shows fluid overload but may have hypotension or electrolyte imbalance, which could make diuretic administration dangerous. Assessment guides safe action. Question 12. A client with acute pancreatitis reports severe abdominal pain 10 out of 10, nausea, and hypotension. Vital signs: BP 85 over 50, HR 128, respiratory rate 28. Which intervention should the nurse perform first? A. Administer IV morphine for pain. B. Start aggressive IV fluid resuscitation. C. Position client on right side for comfort. D. Notify the provider after assessment. Answer B. Start aggressive IV fluid resuscitation. Rationale: hypotension and tachycardia indicate shock risk. Fluid resuscitation is life-saving. Pain control is important but secondary to hemodynamic stabilization. Question 13. A client receiving chemotherapy develops a temperature of 101.8 degrees Fahrenheit, WBC 1200 per cubic millimeter, and new productive cough. Which action is prioritized? A. Administer antipyretics and monitor. B. Collect sputum culture and notify provider immediately. C. Encourage oral fluids and rest. D. Isolate the client but wait for lab confirmation. Answer B. Collect sputum culture and notify provider immediately. Rationale: neutropenic fever is a medical emergency. Rapid identification and antibiotics are critical. Antipyretics or isolation without treatment delays intervention. Question 14. A client with end-stage renal disease reports shortness of breath, confusion, and elevated BP after missing dialysis. Oxygen saturation is 85%. Which is the priority nursing action? A. Administer antihypertensive medication. B. Apply oxygen and notify the dialysis team urgently. C. Encourage oral fluids to reduce toxicity. D. Perform daily weight assessment. Answer B. Apply oxygen and notify the dialysis team urgently. Rationale: fluid overload and hypoxemia are life-threatening. Immediate oxygen and urgent dialysis intervention are needed. Other interventions are secondary. Question 15. A client with a newly placed central line develops redness, warmth, and purulent drainage at the insertion site. The client is febrile at 102 degrees Fahrenheit. What is the first action? A. Apply a sterile dressing over the site. B. Draw blood cultures and notify the provider immediately. C. Remove the central line without further orders. D. Administer prescribed antipyretics. Answer B. Draw blood cultures and notify the provider immediately. Rationale: signs of central line-associated bloodstream infection require prompt diagnosis and treatment. Removal or antipyretics alone do not address the infection source. Question 16. A client with pneumonia develops sudden confusion, hypotension, and mottled skin. Which intervention should the nurse perform first? A. Reposition for comfort. B. Initiate sepsis protocol and administer IV fluids. C. Administer prescribed antibiotics. D. Monitor vital signs every 15 minutes. Answer B. Initiate sepsis protocol and administer IV fluids. Rationale: signs indicate septic shock. Immediate fluid resuscitation and protocol activation are life-saving. Antibiotics are essential but should follow stabilization. Question 17. A client with chronic obstructive pulmonary disease reports worsening shortness of breath, confusion, and oxygen saturation of 82% on 2L oxygen. What should the nurse do first? A. Increase oxygen flow to 6L per minute. B. Perform a focused respiratory assessment. C. Call respiratory therapy for nebulizer treatment. D. Reassess vital signs in 10 minutes. Answer B. Perform a focused respiratory assessment. Rationale: immediate assessment guides safe oxygen titration. Increasing oxygen without evaluation risks CO2 retention. Rapid response or therapy can follow assessment. Question 18. A client with a new colostomy reports bright red bleeding around the stoma. Vital signs: BP 90 over 55, heart rate 125. Which action should the nurse take first? A. Apply pressure to the stoma. B. Notify the provider immediately. C. Prepare for IV fluid resuscitation. D. Document the bleeding in the chart. Answer C. Prepare for IV fluid resuscitation. Rationale: hypotension and tachycardia indicate active bleeding and hypovolemic shock. Stabilization with fluids is critical while notifying the provider for further intervention. Question 19. A client on anticoagulation therapy presents with sudden onset of left-sided weakness and slurred speech. Vital signs: BP 180/100. What is the priority nursing action? A. Administer prescribed antihypertensives. B. Call the stroke code immediately. C. Obtain blood glucose level. D. Position the client supine. Answer: B. Call the stroke code immediately. Rationale: acute neurological deficits in a client on anticoagulation suggest intracerebral event. Rapid response is critical. Antihypertensives or glucose checks are secondary. Question 20. A client post-mastectomy refuses pain medication due to fear of addiction. Pain score is 9 out of 10. The nurse observes nonverbal signs of distress. Which is the best course of action? A. Administer half the prescribed opioid dose. B. Explain opioid safety and benefits for quality of life. C. Respect refusal and document only. D. Notify family to persuade the client. Answer: B. Explain opioid safety and benefits for quality of life. Rationale: education supports informed decision-making and patient autonomy. Underdosing or ignoring pain is unsafe. Family persuasion violates patient rights. Question 21. A client on a telemetry unit reports chest tightness and dizziness. Heart rate is 150 BPM, BP 88/54 millimeters of mercury, SpO2 91%. What is the first action? A. Administer prescribed antiarrhythmic. B. Place client in Trendelenburg position. C. Assess for signs of shock and initiate rapid response. D. Call the provider after documenting. Answer: C. Assess for signs of shock and initiate rapid response. Rationale: hypotension with tachycardia and chest tightness signals possible cardiogenic shock or arrhythmia, requiring immediate intervention. Antiarrhythmic or documentation delays action. Question 22. A post-operative client reports severe abdominal pain, nausea, and distension. Vital signs: BP 92/60, heart rate 128, respiratory rate 28. What is the priority nursing action? A. Administer IV opioids for pain. B. Notify provider and prepare for possible bowel obstruction intervention. C. Encourage oral intake. D. Reassess vital signs in 15 minutes. Answer: B. Notify provider and prepare for possible bowel obstruction intervention. Rationale: signs suggest postoperative complication, obstruction/ileus with hypovolemia risk. Pain control is secondary to identifying and treating the cause. Question 23. A client with chronic kidney disease receiving hemodialysis develops sudden shortness of breath, jugular vein distension, and crackles. SpO2 is 85%. What should the nurse do first? A. Administer prescribed antihypertensive. B. Raise the head of the bed and apply oxygen. C. Call the provider immediately. D. Monitor vital signs every 15 minutes. Answer: B. Raise the head of the bed and apply oxygen. Rationale: immediate management of fluid overload and hypoxemia is critical. Oxygenation and positioning stabilize the patient while further interventions are initiated. Question 24. A nurse observes a coworker administering insulin without verifying the blood glucose. What is the priority action? A. Document the observation. B. Intervene immediately and verify the client's blood glucose. C. Confront the coworker after the shift. D. Notify the charge nurse after the shift. Answer: B. Intervene immediately and verify the client's blood glucose. Rationale: administering insulin without verification is high risk for hypoglycemia. Immediate intervention prevents harm. Documentation or delayed reporting does not protect the patient. Question 25. A client with pneumonia develops sudden confusion, hypotension, and mottled skin. Oxygen saturation is 82%. Which intervention takes priority? A. Administer prescribed antibiotics. B. Initiate sepsis protocol and fluid resuscitation. C. Reassess vitals in 10 minutes. D. Provide antipyretics. Answer B. Initiate sepsis protocol and fluid resuscitation. Rationale. These are signs of septic shock, requiring immediate hemodynamic support. Antibiotics and other measures follow stabilization. Question 26. A client with a history of stroke reports new slurred speech and right-sided weakness. Vital signs: BP 178/102, heart rate 92. What should the nurse do first? A. Position the client supine and rest. B. Call a stroke code immediately. C. Administer prescribed antihypertensive. D. Obtain blood glucose. Answer B. Call a stroke code immediately. Rationale. Time-sensitive neurological deficits require rapid intervention for thrombolysis or other emergency care. Delays increase risk of permanent deficits. Question 27. A client receiving total parenteral nutrition becomes tremulous and diaphoretic when the TPN bag runs out. What is the priority action? A. Hang 10% dextrose in water immediately. B. Check capillary blood glucose. C. Notify the provider. D. Reassess TPN rate once bag replaced. Answer A. Hang 10% dextrose in water immediately. Rationale. Sudden TPN discontinuation can cause life-threatening hypoglycemia. Immediate glucose replacement is required before other interventions. Question 28. A client with a tracheostomy develops gurgling and oxygen saturation drops to 80%. After suctioning, the client becomes lethargic. What is the next priority action? A. Reassess oxygen saturation. B. Call rapid response team immediately. C. Increase suction frequency. D. Position in high Fowlers. Answer B. Call rapid response team immediately. Rationale. Lethargy after airway compromise indicates impending respiratory failure. Immediate escalation is necessary. Question 29. A client with atrial fibrillation on warfarin reports black stools. Lab results: INR 5.2, hemoglobin 7.0 G per deciliter. What is the priority nursing action? A. Administer vitamin K as prescribed. B. Hold warfarin and notify provider immediately. C. Encourage iron-rich foods. D. Continue warfarin and monitor. Answer B. Hold warfarin and notify provider immediately. Rationale. High IN are with signs of bleeding indicates life-threatening risk. Warfarin should be stopped immediately. Other measures do not address the immediate danger. Question 30. A client post-thyroidectomy reports tingling in fingers and around the mouth. Chvostek and Trousseau signs are positive. Which intervention is most urgent? A. Administer prescribed calcium gluconate. B. Reassess in 30 minutes. C. Provide oral calcium supplement. D. Document findings. Answer A. Administer prescribed calcium gluconate. Rationale. Positive signs indicate hypocalcemia, which can cause cardiac arrhythmias. IV calcium is immediate. Other interventions are insufficient. Question 31. A client with Guillain-Barré syndrome has increasing difficulty swallowing and shallow respirations. SpO2 is 87%. What should the nurse do first? A. Encourage deep breathing exercises. B. Prepare for intubation and mechanical ventilation. C. Suction the airway. D. Reassess in 10 minutes. Answer B. Prepare for intubation and mechanical ventilation. Rationale. Impending respiratory failure requires immediate airway management. Suction or reassessment alone is inadequate. Question 32. A client with chronic obstructive pulmonary disease becomes confused, tachypneic, and oxygen saturation drops to 85% on 2L oxygen. What is the nurse's first action? A. Increase oxygen flow without assessment. B. Perform focused respiratory assessment and notify provider. C. Reassess in 15 minutes. D. Administer prescribed bronchodilator. Answer B. Perform focused respiratory assessment and notify provider. Rationale. Rapid deterioration requires assessment before interventions. Unchecked oxygen increase risk CO2 retention. Question 33. A postoperative client with sudden chest pain, shortness of breath, and tachycardia reports feeling lightheaded. What is the nurse's priority action? A. Reassure the client and monitor. B. Call rapid response for possible pulmonary embolism. C. Administer prescribed analgesics. D. Encourage deep breathing exercises. Answer B. Call rapid response for possible pulmonary embolism. Rationale. These signs suggest pulmonary embolism, a life-threatening emergency requiring immediate intervention. Comfort measures do not address the acute risk. Question 34. A client receiving IV heparin develops sudden shortness of breath, chest pain, and hypotension. What should the nurse do first? A. Administer oxygen and monitor. B. Stop the heparin infusion and notify provider. C. Document findings and continue monitoring. D. Administer prescribed beta blocker. Answer B. Stop the heparin infusion and notify provider. Rationale. Heparin-induced bleeding or reaction may be life-threatening. Stopping medication and notifying provider is the immediate safety step. Question 35. A client with a new colostomy reports bright red bleeding around the stoma. Vital signs: BP 85/55, heart rate 130. Which is the priority action? A. Apply pressure to stoma. B. Notify provider immediately. C. Initiate IV fluid resuscitation and monitor closely. D. Document bleeding in chart. Answer C. Initiate IV fluid resuscitation and monitor closely. Rationale. Hypotension and tachycardia indicate active hemorrhage, requiring stabilization prior to definitive treatment. Question 36. A client with a history of seizures is found unresponsive after a witnessed tonic-clonic seizure. What is the first nursing action? A. Place the client in supine position. B. Assess airway, breathing, and circulation. C. Administer rescue medication. D. Notify the provider. Answer B. Assess airway, breathing, and circulation. Rationale. ABCs are always the priority in post-seizure care. Rescue medication or notification follows stabilization. Question 37. A client receiving chemotherapy reports fever, chills, and new productive cough. WBC 800 per cubic millimeter. What is the first nursing intervention? A. Administer antipyretics and monitor. B. Initiate neutropenic precautions and notify provider immediately. C. Encourage oral fluids. D. Collect urine sample for culture. Answer B. Initiate neutropenic precautions and notify provider immediately. Rationale. Neutropenic fever is a medical emergency. Immediate provider notification and infection control measures are required to prevent sepsis. Question 38. A client with advanced cancer requests information about palliative care, but fears giving up. What is the nurse's best response? A. Palliative care focuses on curing your illness. B. It helps manage symptoms and improve quality of life. C. It means you are at the end of life. D. Your treatment will be stopped if you choose it. Answer B. It helps manage symptoms and improve quality of life. Rationale. Palliative care is not limited to end of life. Education empowers informed decision-making and supports autonomy. Question 39. A client with advanced heart failure reports sudden weight gain, dyspnea, and orthopnea. O2 saturation is 88%. What should the nurse do first? A. Administer prescribed diuretic. B. Elevate head of bed and apply oxygen. C. Obtain daily weight. D. Notify provider after assessment. Answer B. Elevate head of bed and apply oxygen. Rationale: immediate relief of hypoxemia and pulmonary congestion is life-saving. Diuretic and provider notification follow stabilization. Question 40. A client post-MI reports severe chest pain unrelieved by nitroglycerin. Vital signs: BP 82/50, heart rate 130. What is the priority nursing action? A. Reassess pain in 15 minutes. B. Activate rapid response and prepare for advanced cardiac interventions. C. Administer additional nitroglycerin. D. Place client in semi-Fowler's position. Answer B. Activate rapid response and prepare for advanced cardiac interventions. Rationale: low BP with ongoing chest pain indicates hemodynamic instability post-MI, requiring rapid escalation. Additional nitroglycerin could worsen hypotension.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.